It is 5:45, finding a way to fill the gap. Arizona facing a major shortage of home care aides, but a Valley nonprofit is trying to change that, advocating for a way to build a pipeline, creating a way to cultivate the next crop of workers. I recently had the chance to see how it all works and how it's all having a personal impact on these students.
Hands on my shoulders. Ready?
To say this is hands-on training would be an understatement.
1, 2, 3 down.
They haven't even graduated yet, but these Cortez High School students are already learning important skills that are setting them up for jobs in the near future and beyond.
It's just an amazing opportunity. People need care, and need to feel like they still have life in them, so I feel like that's the reason why I want to be in healthcare.
Shadai, Adriana, and Carol are all part of a new paid internship program offered through Cortez and Valley-based nonprofit Home Assist Health. The goal? Be advocates for these students and, in turn, the people who need their services.
We came in knowing nothing. We were totally unaware of what was going on or what we got ourselves into.
But these three quickly learn the ropes from the pros and not just the hands-on skills.
These students are already learning about home health and what it means to be a direct care worker and be a caregiver, or care professional as we call it. And so we partner with them to give them an opportunity to learn not just here's the program side of it, being in the field in the home.
Why is that important for you to give them sort of the 360 view of it?
That missing piece was, well, how does a business work? How can I be a really good business partner while also being such a subject matter expert in the field? So I really wanted to bridge the gap.
And that's not the only void they're trying to fill. According to data from the Maricopa Association of Governments, Arizona has more than 1.2 million people 65 and older, representing more than 17% of the state's total population. It's a number that's expected to surge in the years to come. And it's also part of the reason why our state and many others are facing a shortage of home care workers. According to Home Assist Health, Arizona will need 190,000 more home care workers by the year 2030. Do you feel like you're helping to solve the problem?
Yes, definitely. Right now there is such a shortage.
Does this make you feel good inside to do this?
It does, yes. And then back.
Especially for Shadai.
My mother, actually, she unfortunately passed away 10 years ago. Bless her. She was in and out of the hospital, so seeing her in that state, seeing other patients while going to the hospital, it was an aha moment, an eye-opener, definitely.
Did that at all motivate you to do this?
Definitely, it did. She was my number one supporter. I was her little nurse, she would say. So that's something I keep in the back of my mind.
Shadai, you have so much to be proud of. So do the other students as well. I did some digging, found out how the internship program works. Students spend 3 to 5 hours a week. They learn in different departments at Home Assist Health, as well as building those hard skills that they'll need to one day be a home care aide. At the end, students will have enough hours to earn a state-level certification at no extra cost to them, meaning that they're ready to work right after the program ends. So programs are offered at Cortez High School, Skyline High School, and Paradise Valley High School as well. Now, there's also a separate home care program set up through Maricopa County Community Colleges as well, which is a different level of certification. There's another issue, though, impacting these direct care workers, and that's reimbursement from the state's Medicaid program, or ACCESS. So coming up tomorrow, we're diving deeper into this issue and the impact it could have on so many Arizona families, because we know our population here is really aging. So we need these workers, and we need them, of course, to be paid properly as well.
I love that business component, though, just bridging that gap and helping these young people think even bigger, right, at such a young age,
right,
and from the mouths of babes.
Yep, and this is a great first step if they wanted to maybe have a healthcare career or something like that. This is a great little sample, a little way to just taste it.
Excellent information, Nick. Thank you. It is 5:49.